Hello and welcome back for part 3 of the Treatment Paradigm series. This one is going to be going more in depth on those 5 components: movement prep, reactive work, power, strength, and then the cool down. So we'll go ahead and get started with movement prep. Remember, movement prep is going to be that first part of that pie graph we looked at before. It's going to be about that first 15 minutes on a 60-minute time slot. And the goals of movement prep are to really reduce injury, prep the system, for example, the nervous system, to get those impulses, increasing those impulses to the system. Other things we're going to look at are for increasing the core temperature, moving those large joints and getting those muscles moving. We're going to look at improving mobility and reducing neural tone and threat. This is best to be done at the beginning of the session, and then a lot of times we think, oh, we're just moving in this one plane, we're over on the new step getting ready, and we're just moving that one plane. Really think about incorporating all 3 planes when we're working in the movement prep. And so before we go into a little bit more depth on the things we should do in movement prep, I want to address one thing that we might think is movement prep, but research is actually not supporting it, and that is static stretching. And so just know right now that research is not supporting that static stretching actually improves or reduces injuries. So just don't think about that in movement prep right now. We'll address that later in the cool down. Things you should do in movement prep are that active warm-up or dynamic warm-up, and this is to just prepare the body for movement. You can do it times, you can do it for repetitions. Just make sure the patient is getting a lot in and moving the whole time. Another thing that's classified in movement prep is manual therapy. This is really good for those who are post-op surgery, knees or shoulders, where they really need that proprioceptive input to decrease that neural tone. Another important part of manual therapy is improving mobility, and we know that restoring that range of motion by getting in there and doing manual and manipulations, or mobilizations and manipulations, and then also stretching out the capsules and getting those tight capsules and adhesions that have occurred. Moving on to the second component is the reactive work. Here our goal is going to be to turn on those stabilizers, increase that sensory motor training, perturbation training will be in the reactive work, and then our overall goal is to really excite the neuromuscular system. So what are some things you can work on in reactive work? This is also going to include those motor control movements. And so we're going to look at sensory motor training first. This is going to be our dynamic, stability, balance, and proprioceptive training. We all know how to do this. You move from the floor. Once they're good on the floor, you can start adding in foam. Once they're good on the foam, you can start adding in perturbations or moving them around. And so any of these things, endless possibilities here to get working on that. Another thing you can look at is agility training, and this is just those quick movements to really see how the body's reacting to change. So this can include some external cues, again, kind of like the perturbations from before, but just changing up the system so they're not expecting what's coming. So for reactive work, you want to do more for that dynamic balance and stability, 30 seconds to a minute per rep, whereas whenever you move into the unstable surface training, you'll do more the high repetitions, and then if you're doing agility, you'll just set a distance or set a number of times they'll go down and back. That's how you would kind of dose the reactive work treatments. So now we're going to move on to power. The goals of power are to really just to increase the neural stimulation to the system and improve force output by targeting those type 2 fast twitch type fibers. So power is really all about the speed component, and so we want to work on that force and velocity at the same time. And we can do this a lot with those plyometric exercises. And so you'll see those where you're moving at a fast pace on the way up one way, and then you might slow it back down on the other side. So you're getting that stretch and shortening component. When you're doing power exercises, you want to make sure we're not fatiguing too early. So we do want to do a light to moderate resistance, about 30 to 60% of your 1 rep max for upper body and 0 to 60% of your 1 rep max for your lower body. We're going to do really low reps, so 1 to 6 reps on this, and then you can do 3 to 4 sets. Make sure you're taking those rest breaks just so the system has time to recuperate before you get try to stimulate it again. Next, we'll look at the fourth component, which is strength. And the important part about strength is really loading up the tissues and testing everything we've gained. And so in this one, we're really just going to be looking at how much we've gained. And so we're going to be really increasing the load, the intensity, changing it up. In the strength phase, you want to make sure that your patient isn't adapting to what you're doing too easily. So this is where, when we talked about earlier with everything being 3 sets of 10 reps, this is where you need to know that the strength phase is more that 8 to 12 reps, but once you get to that 12 reps, you don't max out there. You want to then go back to 8 reps, increase the load by 5 pounds or so, and then just continually keep changing it up for the patient. So with strength training, as we talked about just before, with power training, we're going to do more of that low resistance. With that strength training, we're going to be doing 45 to 50% of your 1 rep max. For new patients or people who have never strength trained before, but if you have patients in the clinic who have been doing strength training before and they're just rehabbing from an injury, then you can look more at the 80 to 85% 1 rep max. And with strength training, you want to do 3 to 4 sets as well, and making sure you're taking those rest breaks again, which is hard for patients. They want to keep going, but you just need to remember to educate them on why rest breaks are so important. So the last phase, we finally made it to it, is the cool down. And so with this system, we're really trying to just decrease the input we've been putting on the system before they leave. And so with this one, we're also just going to be improving the overall cardiovascular system by just taking a minute to breathe in and out, cool it down. And so here you can use equipment such as the bike, the new step, and elliptical, just at a lower speed. And then, or you can use exercises such as the static stretching, which we talked about earlier. This is where static stretching would come into play more, would be in the cool down phase. For this, you can do about 8 to 10 minutes. Again, you want to just keep the level low so you're not exciting the system too much. Remember, you want to breathe in and out through this phase. I like to do exercises at the end, such as stretching or just simple things at the wall, and have them breathe, like remind them, breathe in through your nose, out through your mouth the whole time through this. That is the end of part 3, talking about the 5 components. Remember, those are movement prep, reactive work, power, strength, and then the cool down. Part 4 is just going to go over a couple of case studies just to give you guys some ideas on what all this means and how it can play into a clinical treatment session. So stay tuned for part 4.